Hi guys, it's Cayley from FT Pikesville, and today I'm going to talk to you about how to train postpartum. Before we get started with some specific tips, I just want to remind you of a couple things. When you get back into the gym to train postpartum, it's really important to be gracious to yourself. You've just been through a whole lot of stuff, and your body's been through a whole lot of stuff, and you just need to remember that as you go back in. Don't have the expectation that you're going to be able to perform the same way you did during your pregnancy or pre-pregnancy. And with that, I want to remind you to manage your expectations. So a good way to do that is to think ahead, even before labor and delivery, and set yourself some realistic goals of what you want to accomplish when you get back into the gym postpartum. It should be pretty small goals, very achievable, to help you stay motivated and encouraged. Okay, so let's dive into some specifics of postpartum training. We're going to talk about two main things. The first thing we're going to talk about is your core. So as you know, if you are a postpartum mom or you're about to be a postpartum mom, your abdominal muscles have been stretching for the past 40 weeks and you felt every single bit of it. Once you have that baby though, those muscles do not just bounce back, unfortunately. Your core is going to need a lot of time to recover. And it's also going to need some very specific things to recover. In order to kind of re-shorten those muscles in the abdominal area and build back that strength, there's a couple of things we want to avoid. First things first, we want to avoid any kind of suspension type core. What does that mean? Well, that's the type of core that's involved in a plank. So anything where our belly is hanging down and kind of on its own, it's not supported by anything, it's just hanging there. That's something we want to avoid. The reason we want to avoid that is it can actually create or worsen a condition called diastasis recti. Diastasis recti is when the abdominal muscles in the middle of your stomach start to separate. It happens usually later in pregnancy and it lasts for a little bit afterwards. It can also happen after you've had your baby and your muscles are trying to recover if you push them too soon, too quickly. This condition is something that is fixable, treatable, but it will require physical therapy, and in extreme cases, it does require surgery. We don't need surgery after having a baby, so that's something that we want to avoid. So the right way to train your core post-baby is to do things that are more supine, so lying on your back, so that you can really focus on engaging the pelvic floor muscles, making sure that your pelvic tilt is in the correct place, so kind of in a neutral position instead of an anterior pelvic tilt that we tend to have during pregnancy. And it just allows us to have better control over engaging those core muscles. So some good core exercises to practice postpartum would be things like dead bugs or heel taps, or even just lying there and practicing your pelvic tilts, glute bridges with a pelvic tilt emphasis. Those are all really good things to start off, and then you can work through progressions of those exercises as those exercises start to get easy for your recovering core. So remember, nothing with the suspended core. Everything should be lying on your back to start. And the recommendation of length of time to avoid suspended core is actually approximately 12 weeks to allow your abdominal muscles time to heal and recover to avoid that diastasis recti that we talked about. Okay, so the next important consideration with training postpartum is sticking with bilateral exercises. Bilateral exercises are things where we use both sides of our body at once. So some examples for the lower body would be squats or RDLs. Upper body would be like a 2-arm dumbbell bench or a TRX row. Now the reason we want to stick with bilateral instead of unilateral, so one-sided things, is because pregnancy does a lot of weird things to our hormones, and so does labor and delivery. Post-labor and delivery, we have a lot of relaxin hormone and a lot of progesterone in our bodies. And those hormones are really great for labor and delivery because they help relax muscles and ligaments, specifically in the pelvis, to help prepare the body for labor and delivery. But post those events, they're not so great, and it makes your joints a little bit unstable and a little bit too mobile. So we don't want to put our body in positions where it has to fight extra hard to keep the joint where it's supposed to be and moving the way it's supposed to. It's almost too much stress on those muscles and too much stress into the joint. But for the first few weeks, I would probably avoid unilateral exercises altogether, and then I would slowly build them back into your program. This will allow your muscles around those joints to build up their strength again. It'll also allow your body to clear some of the hormone out of your body. Just make sure you take it slow because research shows that you have elevated levels of progesterone and relaxin in your body for 5 months after delivery. So just make sure that you're really careful with your progressions. And remember, something is always better than nothing. Right after you have that baby, you are going to have a lot going on, right? You're not going to be sleeping very much. You're going to have hormones all over the place. You're going to have a little person who needs you, or maybe multiple little people who need you, and probably a couple big people who need you too. So go easy on yourself. Something is better than nothing. Getting to the gym and working out and being active is better than sitting at home. But don't put too much pressure on yourself. You're not going to the Olympics. You're not, trying to show anybody anything or prove yourself to anyone. Just make sure that you do something that's going to make you feel better mentally and make you feel better physically. And of course, if you have questions about what that looks like or how to do that, you can always reach out to us here at FT. I hope those tips were helpful. And remember, you got this, mama.